It's day 3 of a nurses' sit-in. 24 of them saying they'll stay there until the governor passes safe staffing legislation. They're talking about 2 bills. They say not only addresses staffing levels, but tackles rising health care costs. That's pitting them against the Mayo Clinic. And in an email last week made public by the Minnesota Reformer, Mayo Clinic called these bills harmful. And Mayo threatened to pull billions in funding out of our state if these bills pass. To understand that impact, you have to know Mayo's history and its stronghold, especially in Rochester.
Jana, we're looking into sort of the impact on all of this, and I think anybody will tell you that Mayo doesn't really back down from a threat. So this is a very real possibility, and it has people calculating what it could mean for businesses, the economy, community, as the clock on the legislative session is also ticking. Rochester, Minnesota, the 3rd largest city in the state, in part because of Mayo Clinic, founded some 150 years ago after a tornado tore through, and a father-son doctor duo teamed up with local nurses to help, eventually starting a permanent hospital.
I had a chance to work for the greatest organization on the face of the earth
that Dave Senjem worked at for nearly 45 years. The longtime senator, now also turned county commissioner. What would Rochester be without Mayo Clinic?
A pretty hollow city. Just about everything that you see as you drive into Rochester is about Mayo Clinic.
Mayo is ranked a top hospital, raking in more than $16 billion last year with more than 2,000 beds and nearly 50,000 employees here alone. That now is warning it could pull back $4 billion in state investments, a threat Senjem says isn't an empty one.
This is a unique proclamation that they've made, but it's an honest proclamation.
Last week, Mayo's lobbyist expressed frustration with 2 bills the Minnesota Nurses Association says would require hospitals to form committees, defining the number of patients each nurse can care for, along with creating an affordability board to tackle rising health care costs.
They exist to be the best health care center in the world, and by all accounts, they are. And in terms of getting to that status, they have to be able to manage their own organization.
Mayo hasn't made note of any specific project, only saying it would reconsider its plans if the bills pass. But that has businesses paying close attention, from agriculture to manufacturing.
But clearly, health care drives this local economy.
John Wade leads Rochester's Area Economic Development Group and says losing that much money would be significant to the city's future, and remains hopeful the sides can find a solution.
Not only for Rochester's good, but certainly for the state of Minnesota, and indeed the U.S. economy as well.
Mayo may be homed in Rochester, but it's also expanding its campuses in Florida and Arizona, as well as building in London and Abu Dhabi. And if that money goes elsewhere, so too could the city's flagship status, something Senjem calls irreplaceable.
They can move that investment. That's very easily done, and they can grow the practice in a larger sense in other locations. The place where Mayo will then grow and advance into the future.
The state has already committed nearly $600 million to help Rochester cement itself as a destination medical center. Mayo contributing another $934 million, all part of a 20-year plan that now could also be in jeopardy.
It is completely unethical for Mayo.
The union, though, says the reforms are long overdue, calling Mayo's response corporate bullying. But 62 leaders from every nonprofit hospital in the state have since signed a letter telling lawmakers the bills are detrimental.
This heavy-handed bureaucratic way to set staffing, to have arbitration and lawyers deciding how we should provide care, that is going to be damaging to the healthcare system that we are so proud of in Minnesota.
The head of Minnesota's Hospital Association says it's focusing instead on loan forgiveness and recruitment to fill the 5,500 open nursing positions, adding only 20% of those who are working are in the union. But no matter what happens, will likely change the way we know healthcare well into the future.
This is a bellwether moment in the history of Mayo Clinic, and I just hope that the legislature and the governor think this thing through a little bit and find a solution.
So as for the bills, they have both passed the House and the Senate, so they are now in committee. That is where these 2 sides will now hash out any differences. They have to come to an agreement again and then vote on that, and then that is what would go to the governor for his signature. All of this, Jana, which has to happen before the end of the session, which would come up on May 22nd.
Yeah, 11 days from now. And the governor has said last week he's looking for compromise, right?
He's hoping for compromise. He said he supports the nurses, but he has also said said that he recognizes Mayo as sort of this unique independent entity as well.